And my second question is, it was also noted, I believe, a little bit in the Consumer Reports release about this, was that some of the financial reasons why these tests are done are because they do benefit the physicians financially, or their offices financially. Could you address that as well?
Let me take a crack at that, Jim. That's an excellent point. The first rule of medicine is doctor do no harm. That's what we all should be living by. And I referenced something I refer to as our triple aim. The first one being that we want to try to avoid illness, so screening is critical. The second part is that the procedures that are being done are done with the appropriate quality, which means in the appropriate setting where outside bodies are actually looking at what is being done in those centers, accreditation, licensed centers, centers where appropriate levels of outcomes are being measured. This is how you get at the point of minimizing the risk to the patient, because everything we do to a patient has a risk. The third part being the surveillance part, the repetitive nature, which comes into not only a financial piece, but also a quality and risk piece involved. This is where we feel that guidelines, evidence-based guidelines, are so critical so that patients don't come back too soon, are not exposed to excessive risks, more so than they have to be exposed to manage their illness. So those three pieces, make sure we get to the screening so that we avoid the illnesses, make sure what we do is done with the appropriate quality, and the third piece is to make sure that the repetitive nature of procedures is minimized, and along with that, the risk.